CPT JJ-CPB Introduction, page 15, part 12.
Special report.
A service that is rarely provided, unusual, variable, or new may require a special report.
Pertinent information should include an adequate
Definition,
or description of the nature
extent,
and need for the procedure and the time, effort, and equipment necessary to provide the service.
Right. If there is a new procedure, for instance, that it has not been done, doesn't have a code or anything, and all you have to do is just follow all the guidelines here to make a report of this new procedure. And just as an extra information, there is this little here cell that we have, and it's for special reports, right? CPT 99080 are reports specifically requested by the insurer. Only certain types of reports are reimbursable. Okay? So that's our theory for today. Now we're going to do a problem. So ready, set, go. All right. CPT JJ-RVA-262. That's the page, and the exercise is 106, and this is a level 1 exercise, and the title is?
Hysterectomy, total abdominal.
And the text reads?
Surgery, female genital system. Patient has been diagnosed with uterine fibroids and undergoes a total abdominal hysterectomy with bilateral salpingo oophorectomy.
Hysterectomy is to take the uterus out, right? Because it has a uterine fibroids. And bilateral salpingo oophorectomy is to take the fallopian tubes, both of them out too, right? Okay, so that is the procedure. And now we're going to count to 3 so you can give us the CPT code for this procedure. You have to pause the video, right? So 1, 2, 3. Okay, the answer is?
58150.
58150. If you got that, congratulations. If you didn't get it, let's give you a couple of tips. First tip.
Start with hysterectomy. Second one is salpingo oophoro is the fallopian tubes.
And we can add here that the uterus is hystero, right? Uterus is hystero. Uterus is hystero. Yeah, that's right. Okay, and you see a picture there of the female reproductive system, and then we're going to show you a video of what exactly is the anatomy of the uterus and the fallopian tubes, right? So let's see.
The uterus or womb is a hollow pear-shaped organ which sits in the lower abdomen or pelvic area.
Okay, thank you.
It has the bladder in front of it and the rectum behind it.
That's the uterus, right?
Yes.
In the uterus it has the fallopian tubes, one here and another there.
Extending from either side are the 2 fallopian tubes, which lead to the ovaries.
Oh, is this the ovaries? The fallopian tube is there, these, right?
Yes.
Okay.
At the base of the uterus is the cervix, which opens into the vagina.
Okay.
The uterus is held in place by structures called ligaments and has a rich blood supply from vessels called the uterine arteries. An abdominal hysterectomy is a major operation to remove your uterus. The surgeon may also need to remove the fallopian tubes, ovaries, and cervix at the same time. An abdominal hysterectomy is performed to resolve certain conditions, such as fibroids and heavy periods.
Fibroids in our case.
Fibroids are caused by an overgrowth of the muscle in the uterus, causing heavy periods and pain. There are other conditions which contribute to the need for an abdominal hysterectomy, and these will be discussed with you by your specialist doctor, a gynecologist. It must be remembered that after having an abdominal hysterectomy, you will no longer have periods. When a decision to undertake the operation has been made, You will be seen before your operation in a pre-assessment clinic and assessed by a doctor and nurse.
Okay, so now you have an idea exactly what a hysterectomy is, and this includes the fallopian tubes too. So, and the answer, you know, that is 58,150, right? So now we're going to count to 3, so you can pause the video and give us the path, how we got to the answer, right? 1, 2, 3. All right, this is the summary of the whole problem. It is a surgery section of the CPT book, is the female genital system. The patient has been diagnosed with uterine fibroids and undergoes a total abdominal hysterectomy with bilateral salpingo-oophorectomy. There's only one code, and the code 1 through the index is found like this.
First you go to index.
Go to the index.
You start with hysterectomy.
You start with hysterectomy, with the H, hysterectomy, and then you go to
Abdominal.
abdominal, because it says abdominal, and then
Total.
total. And then you have how many codes?
5. You have 3.
3 codes, right? 58,150, 200, and 956, right?
Yes.
Now we're going to check all these codes. So the code 1 through the tabular is checked like this.
First you go to tabular.
Go to the tabular,
You start with 58,150.
which is the first code you got from the index, right? And what is that?
Total abdominal hysterectomy with removal of tubes.
It looks like this is what we need, but let's just check the other ones. Since there are only 3, let's just check the other ones just in case. What's the second one?
58,200 is partial vaginectomy
Partial vaginectomy. We
with
don't want that.
parotid aortic.
With para-aortic, no, we don't want that. And the next one?
58956 is bilateral salpingo-oophorectomy with total omnectomy.
Omentectomy, right? Now, we don't have this, right, in our description. And the salpingo-oophorectomy is this one, removal of tubes. So that is exactly the same thing as saying salpingo-oophorectomy. So we have salpingo-oophorectomy, we have hysterectomy, and we have abdominal, and we have total. So we have to go back to the first one, right? So we go back to the first one, and the equal sign means that that's our code. We have double-checked it, right? So the answer is 58,150, okay? Thanks for watching, and don't forget to visit our website, and also
you can subscribe to us in YouTube by clicking here for our new medical coding videos.
right, just click on the subscribe button and you will get
up to 3 videos every day that we make. ICD-10, CPTs, all that's needed to pass the medical coding certification exams.
So thank you. Please, so don't forget to visit our website and also to subscribe to our videos. Thank you.
Goodbye.
Bye.